Guys, welcome back to Medical Coding with Blue. Today's episode is all about what to do if you keep failing a medical coding certification exam, and a little few words about my tutoring program. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay guys, so I got this message, and I've gotten a message before that sounded a little similar in the springtime, right? But I'm going to read the message and then we're going to get into it. So here we go. So the message is, "Hi Blue, I need some help. I have taken the AAPC test 7 times and always screening in the 60s. So now my boss wants me to try the CCA, and I have been coding for 2 years and I really need to get certified. Can you help me?" So here's another, this is just a word about my tutoring program before I get into this whole thing. I am not accepting any new clients because my calendar is currently booked till the end of August. So if you want to get on my calendar, the earliest that you will be able to get onto my calendar is September 2024. I will start booking for September dates in August. Okay, so just a few weeks away, just a couple weeks away now. But just so you guys know, when I do tutoring, what is it like? It is 1 hour minimum. No, I do not go less than 1 hour's time. Okay, it is 1 hour minimum, because that way I can kind of gauge about what's happening, because I can pretty much pinpoint what somebody's problem is within the first few minutes. And then we kind of like sort out, like, you know, what do we need to do? We create a plan, we talk about it together, and we go over some of the things that they're really, you know, that's really troubling them with these codes. And that's what we do. I don't have a school per se, as far as like a program and things like that. But what I do offer is my independent study list. And that's going to have your whole syllabus. And I offer this for free. Now, trust me, especially this year, some people are just really making me consider whether I should take the whole thing down to begin with, because of the simple fact that there's a lot of people out there that are ungrateful, or they want to sit here and question and hem and haw and things like that. So on my independent study list, it's a syllabus, it's broken down. So if you follow it and you follow the books and all these things, it'll take you about a year to get through, 9 months to a year to get through. And it's just a way of you saving money and studying, still getting the same kind of education, still being able to pass the certification exams, because people have successfully gone through this and been able to pass, and they didn't even have to go through a school because they went through my independent study. Okay, so because of this, what I do is I try to save people money, because this field is very expensive. This is not a cheap field. Okay, if you are thinking that you can just get away with, oh, you know, no. Trust me, it gets real expensive real fast. But that's when you have to be smart, and that's when you have to do your research, and that's when you have to think outside the box. So for me, when I think about where I was financially when I very first started, and how I had struggled and things like that, and how I wish that maybe somebody had told me. But again, I didn't know anything about medical coding, and I had gone through a program that paid for my medical coding program. So I went to it was WIA at the time, now it's WIOA, the Workforce Innovation and Opportunity Act, because I was unemployed. And there's a lot of programs out there that can help you if you are unemployed, if you were laid off, if you are in a minimum wage paying job, you know, that's like you're barely making it. They can get you into these programs. There's a lot of people that qualify for these programs and they don't know about them. Okay, and I've talked about them before. You can go through my channel. I've done a couple of videos specifically on the WIOA program and how wonderful it is. But that aside, you know, in the independent study list, it's got all your syllabus, all the time broken down and everything, how long you should spend on each subject. But also in this independent study list, the books that I recommend are older, right? Like the workbooks, they're a couple years older. Now, I try to go back and update the independent study list based on the year that it is, because I think in 2019, 2020, 2021, I was still recommending the 2019 book, because, you know, that was when I had studied for my Ccs-P and my CCS. And so I was recommending books that were a couple of years old. Well, again, I have probably 1,300 videos by now, or darn near close to it, on my channel. And so trying to go back and update a lot of these is almost impossible. So, but I do say that if you see that the books that I recommend there are like 2021, 2022, you can always get the same year, whatever year it is, 2024, you can get the equivalent of that book. But then I get people that will write to me and say, oh, can you update the links? Because you can't look, because you can't type in the same thing and just be able to find the same title of the book, but the 2024 edition or whatever year it is, because you can't do that. So again, that's what's making me like really consider taking the whole thing down, because again, people are just ungrateful. And then I hear, well, Blue, this would be really great if you updated it. Then don't look at it then. Don't look at it. I mean, again, it's free information. And if you can't be gracious enough to just be thankful, because that's all you have to do is just say thank you. Okay. And if you need to find, again, the current year book, you can always Google it. It's the same title, just Google the current year book. And so, but again, I do that to save y'all money, because you can still use workbooks that are a couple of years old, right? Now I tell people, we're in 2024, try to go back to 2022. Now, if you're going to get a workbook like the CPC study guide or the ICD-10 CM and ICD-10 PCS coding handbook with the answers, right? Try to go back to 2022. 2021 is getting a little old, but you can still use it, okay? It's still going to have a lot of the same things. But what you want to do is get the practice in, because even if you do get the 2024 editions of the books, right, your coding manuals, and you're using a 2021 or 2022 workbook, some of the codes may have changed, but for the most part, a lot of them, like 90% of them, 95% of them in some cases, are going to be the same. The codes are going to be the same, like the answers and things like that. So it's not going to be a big deal for you to use an older book. Now, for some people, they want to use a current year book. If you want to use a current year book, you're going to be paying this more money and for the same information. So that's why, again, why I try to be as conservative with you guys as far as like how much money are you spending, because again, people can go wild willy-nilly spending all this money, and for what, you know, when you can get the same thing. It's the same material. The only thing that I tell y'all is to make sure that your books are current, and you can always go download for free the ICD-10 CM coding guidelines, official coding guidelines for coding and reporting. And you get that from CMS. And you can listen to it, you know. But for those of you who want to complain about the voice being so monotone, well then read them then. Read them yourself then. I just say it just so that you guys have something that can kind of break up the monotony of what you're doing when you're studying. Because I understand that sometimes it's a lot to read all day long. You know, I get it. I mean, I'm a coder. I read all day long, but I love to read, you know. But when you're studying and you're brand new at studying, or you have been in the field like this lady, you know, it's a lot when you have to sit there and concentrate on like, okay, these scenarios and things like that. But you know, the number one reason why people, and I've done this poll before, the number one reason why people fail exams, the medical coding certification exams, is because they are not studying enough. You know, you want to sit here and put in, like the other lady, an hour and a half a day, if that. You want to put that in, and you think that that's sufficient enough. If you're doing 3.5 hours per day for 5 days a week, and I feel like I'm a freaking broken record when I say this, 3.5 hours per day, and you do this over the course of 5 days, that's 17.5 hours you put in. And then you have a Saturday or Sunday to put in 2.5 hours, and you did 20 hours in a week. In a week. Think about all the time you spend on social media. TikTok, Instagram, Facebook, YouTube, all these things. Think about all the time that you spend on there, that you could have been putting that time towards studies. Now, I may have hurt this lady's feelings when I told her that, you know, if you sit down with these workbooks and on the independent study and you do this consistently for 3 months, you study 20 hours per week, you'll be able to pass that certification exam, because the base knowledge is already there. She's been a coder for 2 years. This should not be. You should not be taking the certification exam that many times. Somebody should have stopped you. Somebody should have done an intervention, because that's too many times. And this is the second person this year who's confessed to doing this very thing, taking the certification exam one right after another. Boom, 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 boom. Why? Because then you're just rolling the dice, just trying to pass. Oh, well, it's my nerves and it's test anxiety. No, there's no such thing most cases. Some people, yes, that's actually a thing for them. But for the most part, people get too much in their head. If you have been practicing with those workbooks, with your books, you're going to be able to pass. Not one time have I heard anybody tell me, you know, Blue, thank goodness I tabbed my book, because the tabbing is what made me pass my test. Tabbing does not make you pass your test. Writing in your book does not make you pass your test. What makes you pass your test is actually practicing. Practicing. Blue, I don't understand it. Okay, this is when you have to reach out and you got to find yourself a mentor, somebody who can help you for free. There's a lot of people on LinkedIn who are more than willing to give a guiding hand to people out there who are, you know, lost. Or sometimes I've seen a few of the people who follow the channel, they will post a scenario that stumped them. And one I did respond to her. The other ones, sometimes I don't respond because somebody's going to come in and say something anyway, as far as like the answer and things like that. And they'll explain it to them. But this one particular one that I responded to, I really like her. So I went ahead and I answered her, because to me, it's a very simple, straightforward thing. But if you're brand new, it's very difficult to see, because it's not exactly clear on why it is. Okay. And so I explained it, and I think I did a pretty good job, because I think she got it after that. But she did have other people that responded to her as well. But that's the thing, guys. You know, there's people out there that are willing to help you. Okay. Now, if you really want that one-on-one cultivated attention and like, okay, we're going to figure out what's going on, what's happening. If you want the no-nonsense approach, then I'm your girl. If you want somebody who's going to sit here and coddle you and hold your hand and no, that's not me. I don't coddle. I don't do that. Because in this world, there's no time for it. There's no purpose for that, because it makes people weaker. Okay, it makes people weaker. And I'm about letting y'all figure stuff out. Now, yes, I will come in with a helping hand when I see that it's needed. Yes, because that approach is not always the right approach, right? But for the most part, it is. Because if you let people know that, oh yeah, all your nonsense and all this wildness, then they'll just do whatever. And trust me, that don't work either. At least not for me. So that's what I'm saying. If you are stuck, find yourself a mentor if you don't have money to pay for a tutor. If not, if you're not getting the attention that you need, or you know you're not getting the clear answers, or it's not helping you at all, find yourself a tutor. Now, a tutor you're going to have to invest in, and make sure that the tutor understands like your needs. For me, again, when I'm meeting with a client, especially somebody that's new to me, I will ask them about like what are their needs and what's going on, because sometimes it's just foolishness that's going on, and that's kind of like what needs to be called out, and then it gets people back into attention, like, okay, this is what I got to do. And so sometimes that's what you need. But for the other times when I explain things and they're like, oh gosh, now that makes much more sense, because I love what I do. I love every aspect of coding, you know, and I can explain it quite well. And that's the thing. And that's what sets me apart from like, you know, oh, I don't know, and this and that. And some of these answers I've seen like on like some of these message boards and things, I'm like, oh my gosh. No, you know, that goes against like coding, and no, but I digress, you know. Don't do this. If you are taking the test and you keep repeatedly taking it because you're trying to just see if you can pass it, and you keep taking it because it's the law of probability that you're going to end up passing it if you keep doing that. Why keep doing that? And you're spending so much money. and not passing the test or barely passing the test. Again, if you are taking 3 months consistently back to back to back, studying 20 hours per week, no excuses, none at all. Because really, if you want this, you'll make the time for it. You know, people make the time for things that are important to them. People make the time for any activities that they want to do. They will make the time. If it means getting up early, if it means going to bed later, if it means getting the time in little bits here and there wherever they can. And again, I've talked about this several times. Listening to a video on anatomy, on HIPAA, on any of those things, listening to the guidelines, except for the people who want to be fresh about, oh, it's monotone. Listening to the guidelines to kind of help you to like, okay, it's going to jog your memory. When you're taking that test and it's going to be asking you a question, and say, for example, that question, you know, if there's something about sequencing in that question because of the way that it's worded, and then you're like, oh, I know where to look in the guidelines, because you'll have the book in the room with you. You will have the book in the room with you. So again, if you are familiar with the book, you'll know exactly where to go so that you can find your answer. So that you can, okay, yeah, this is how I gotta get to these, this is how I gotta do this is how I gotta get to the answer. So that's what you want to do. Stop taking the test. If you've been doing that, just trying to hurry up and pass, no, stop. And to this lady, you want to go from the CPC to the CCA. All right, let's talk about this. Some people think, well, if you can't pass one, maybe you'll be able to pass the other one. All right. I don't know if this lady knows that the CCA also includes inpatient coding. So now you opened up another can of worms. Now you got to know about DRGs, MSDRGs, present on admission. You got to know about inpatient coding rules, which are different from outpatient coding rules. And you have to learn ICD-10 PCS, which is the procedure side for the inpatient side. So those procedure codes, those ICD-10 PCS procedure codes are looked up very differently, okay? And when you think about it, and being that you have been studying for AAPC, if you are not using the books like I suggest, which is like the Optum books, because it's not an ad for Optum, but you know, guys, the tools that you use are going to be able to change the way that you look at coding. If you have the Optum ICD-10 PCS expert edition, right, the spiral bound one, in the back in Appendix M, like in Mary, there's a list of 388 procedure codes that you can look up. And then in the back of that Appendix M, there's all the answers, and some of those answers have the rationale. So what you want to do is you want to start from number 1 all the way to number 388, because the more you look and practice on those, looking up those codes, the better off you'll be, because you have to learn about the surgical approaches, which are different from CPT, because in CPT, a removal is a removal is a removal. And ICD-10 PCS, oh, no. The rules change. What does removal mean? You know what I mean? Like, so everything is different. In ICD-10 PCS, they have words like extirpation. No, I say that word like that because that was my nemesis when I very first started learning. And I had been learning ICD-10 PCS since 2014, when we started learning and training for the implementation that happened in October 2015. But then I said, oh, you know, I don't need, what do I need PCS for? What do I need inpatient for? I'm in the outpatient side. What do I need it for? You know, I already have my credential. Big deal. Well, 2018, Medical Coding with Bleu on YouTube debuts, and so yeah, the things change a little bit. So, you know, I ended up getting the Mastery Medical Coding Certification, which is the CCS. And the rest is history, of course, you know, but I got that a few years later in 2021 is when I got it. And the only reason that I did is because I have things going on in the background. and I had to change my credentials. And so the Ccs-P came first for me. And then, there's the CCS. But to this lady, they're telling you, oh, well, why don't you take the CCA? So now you have to add on something else new that you got to learn, right? You got to learn the inpatient coding. I don't understand why you don't take the CCS-P, which is a Certified Coding Specialist Physician base. This is the outpatient credential. So there's only outpatient. So, the CPC is a flagship medical coding certification from AAPC. And that says that all you know is outpatient coding. If this person is only coding for outpatient coding, then go for this CCS-P, because it's the same thing, but it's a little bit different because, of course, it's with AHIMA, and the domains are a little bit different, but you can see what the domains are on the AHIMA website, and you can be able to base your studying on that. So if you say, Blue, I'm really good with CPT and stuff like that, well, then continue to practice with CPT, get the CPC study guide, even though you're going to sit for the CCS-P, because we all use the same CPT code set. Do the things that I instruct in that independent study video. And again, that link for that is in the description box below. Follow that. Go through those workbooks. Work through those workbooks. And then, that way you can be able to only focus on the outpatient side. You don't have to add the inpatient side, because taking that CCA, you're going to add that inpatient side to your studies. And then here we go again. So again, if you're right there with that outpatient, that's telling me that you need to just do more practice. And the more practice that you get in there, the better off that you'll be. And you'll probably be more successful taking the CCS-P, because now you know what to do. Because trying to keep taking the same test over and over again, just trying to pass it, that's never going to work. You're just giving the association more money. Not only that, it's like your membership dues and everything else with AAPC. That's their business model, because they are a for-profit organization. AHIMA, the American Health Information Management Association, is a non-profit organization. So because of that, you have a choice of whether or not you want to be a member. With AAPC, you don't. The second you don't pay your membership dues when they're due, they'll take your credential away. With AHIMA, you don't have to be a member, but they will charge you to report your continuing education units, which are less, by the way, because the CCS-P is 20 CEUs for the 2-year reporting period versus a 36 continuing education units for the 2-year reporting period with AAPC. I'm just saying. But again, it's entirely up to you guys. But I told this lady, you can do it. I mean, if you dedicate those 20 hours. I mean, again, she didn't respond to me, so I don't really know what her reaction is. But I'm going to be very straightforward with y'all. If you're not putting in 20 hours per week and you keep failing, that's probably the reason why. It has nothing to do with your nerves, because the more time you put into it like that with the 20 hours per week, the more confident that you'll be walking into that room. This stuff will be very familiar to you because, again, you've been at it for 20 hours per week. And again, you do this consistently for 3 months, and then you'll be prepared. You will be prepared, because look at all that time and all those hours that you spend, right? Because that's 80 hours per month in 3 months. 80 hours, 80 hours, 80 hours. 240 hours that you will have spent studying. And you can't tell me you're not going to be more confident walking into that room with all that time on your belt. Right? I'm just saying. So, with that said, stop taking the exam if you keep failing it. Stop taking the exam if you keep failing it. Study for 3 months. It doesn't matter. People pressuring you, whatever. It doesn't matter. You need 3 months to prepare. Consistently study for 20 hours per week. And then take that test. And then come back and talk to me. Tell me that you passed the test. Or tell me what happened. But more than likely, you're going to pass that test because you're being consistent. You know, consistency is the key, right? I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see you all next time. Bye.